Hi, I'm Prasad Calyam. I'm a professor in computer science at University of Missouri. And in this lab exhibit, I'm going to talk about this project that is funded by the National Science Foundation to help researchers, clinicians deal with all this data we're getting about COVID-19. And this project is helping in development of tools that allow these scientists working on helping us overcome this COVID pandemic to have the right access to the right data so that they can come up with better patient care. And this project is in collaboration with my colleagues, Mauro, Lemus, Roland, Oruche, Ashish, Pandey, and Yuan Zhang. And like you see this cartoon, a researcher today is inundated with a lot of data. There's lots of publications being written from labs all over the world, from all the way from opinions to systematic case studies. And it's very, very hard to know which attention should be paid to which publication, right? So if the publication has a lot of evidence, we want to have that more useful in making our decisions. So how do we find that kind of right knowledge in this whole stack of these papers that are being thrown at us every day, right? And so we're building tools that helps these people at the front line of the COVID-19 pandemic who are helping us contain or prevent or even find cures for the current COVID-19 and future pandemics, right? How do we find the right knowledge in these publications? So we're going to talk about that. My students next will give you more details of our research and also show you a demo how well our system for data analysis works for helping clinicians and researchers.
Thanks for watching this presentation about our one-time evidence system. Here we are presenting the components and features of our one-time evidence solution, which aims to help researchers on finding relevant literature and reduce the burden of manual search on big sets of scientific publications. As a particular use case, our system was set to streamline the process to find high-quality publications related to the COVID-19 topic. When a scientific trend topic arises, an exponential growth in related publications is experienced, like in this case, publications about the COVID-19 pandemic. So researchers find themselves overwhelmed by the amount of effort and resources required to review and select the most suitable publications for their research. One example of a huge collection of documents is the COVID-19 Open Research Dataset named COVID-19, which includes thousands of publications about this topic. A tool researchers use to filter scientific papers is the level of evidence pyramid, which is a framework used to categorize papers based on evidence provided. So as more level of evidence is provided, less documents are found. We are incorporating this tool in our system, allowing the researchers to select the documents based on the level of evidence. Our solution approach provides a cloud-based service that includes multiple data sources, a data pipeline orchestration, which leverages the Odyssey on AWS platform, the data access and workflow management, and the analytic workspace. Our solutions allow the integration of multiple data sources into a common data model, which is part of Odyssey. The common data model stores the data following the OMOP CDM framework that streamlines the healthcare data retrieval process. The Odyssey on AWS also includes the Jupyter Hub, among some other tools, which we leverage by adding data request forms to allow the researchers to request the data elements needed for their research. In this case, researchers will request COVID-19 papers using the level of evidence that is suitable for them. Upon submitting the request, researchers will query the data and get the data set that will allow them to start the knowledge discovery process. Once the result set of scientific papers is available in the workspace, so researchers will be able to use the flexible analytic tools of the Jupyter environment so they can customize further data retrievals and execute additional queries and run data analysis using the Python libraries. As a result, researchers will have a filtered set of papers allowing visual results indicating the metadata of their results, like in this case, the distribution of topics found in the result set. Once the researchers are satisfied with their findings, they will be able to share the results and read the documents found with other scientists. As a result, here we can see an example of the distribution of topics found in a particular data set. And also, we have in this chart the comparison between the manual and automated process that is provided by our system. We can see that the papers found with the automated process is bigger than the papers found with the manual process. So it will give the scientists the freedom to select the papers that are higher in terms of relevance. Now, we are going to demonstrate how our system works. Thank you.
Well, let's say I was a researcher, for example, and I wanted to choose systematic reviews. And the next thing that we've done is that we provided topics that we've generated based off our domain-specific topic model. So now researchers can actually choose a topic from here. And let's say I wanted to choose this topic. And I'm also able to select the number of papers that I wanted to choose. So let's say I wanted to choose 50. So let me go ahead and run it. I'm going to run it one more time. And this shows essentially just the papers that we've collected. They were all under level 1, and they're all limited to a specific amount. In this case, it's just 50. So it's indexed from 0 going all the way down to 49. I can go ahead and run this. And putting out the topic number will essentially get the distribution. So what the distribution shows is that these are the words that were chosen within that topic, right? And this distribution shows their percentage occurrence. So this is the percentage of words that were in that topic. So you can see within that topic that I chose, number 4, health was the most commonly used word, then disease, and then the 10th most was just like infectious and based. So that's essentially how users are able to see, to use this workspace analysis to not only get the papers that they want to retrieve, but also get some type of data visualization of some sort. Thank you.